Let's take a look at the latest on the coronavirus now. Cases in the DMV continue to see a downward trend. The moving average of cases in D.C., Maryland, and Virginia have been going down for a bit, even since the area reopened. And even with increased testing capacity, you can see the number of cases is lower than we've seen. And that also means the percentage of cases is also dropping. So let's hope that continues. Meanwhile, there's a new information this morning about the spread of coronavirus. It has to do with asymptomatic people, those who might have the virus but don't have any of the symptoms like fever or shortness of breath. The country went into lockdown partly because of the concerns that these people could be spreading the virus without even knowing it. But now the World Health Organization is saying the opposite. And Matt Gregory has been looking into this and spoke with experts from Johns Hopkins University. Matt, what are the experts now saying?
Yeah, it's basically a change, and as we learn more information, Annie, about the virus, because we're still in the infancy stages here in the United States, we're learning about how it's spread. And so what they're saying basically is that unlike we were told weeks ago, where people who were in public who weren't showing symptoms might be the key spread to the virus, that's simply not the case. Now, this isn't a license for things to go back to normal, for people to ignore social distancing guidelines or to stop wearing masks, but it is an area where we're learning more to better understand how the virus is spread.
It still appears to be rare that an asymptomatic individual actually transmits onward.
Groundbreaking news out of the WHO press conference. Asymptomatic patients rarely spread coronavirus. Now, to understand that, you have to know first what asymptomatic means.
That doesn't mean subtle symptoms, it means zero symptoms.
Dr. Amish Adalja from Johns Hopkins University is an expert on infectious diseases. He explained that for weeks we've been told that people with the virus but no symptoms could be the key to the quick spread. But that was difficult to measure.
It's very hard when you're interviewing patients for them to be able to distinguish between mild symptoms and no symptoms.
This is an important change because, according to Dr. Adalja, it shapes what we do
as we move forward in the pandemic and we think about what recommendations we need to do in terms of testing, in terms of masks.
Now the focus turns to people with mild symptoms. The WHO says to follow each of these cases, trace them, and quarantine them would drastically reduce the spread of the coronavirus. Yeah, and another point that Dr. Adalja had was that there are pre-symptomatic people, or people who are not showing symptoms yet, but then do show symptoms. Are they contagious in that infancy stage where it's incubating in their bodies? Do we know whether or not that is a primary spread of the virus? They're still working to get more information on that because, like I said, so much of this information we're learning is still new and being developed as they're going through different research models and as they're going through different information that comes in, not only to the WHO, but the CDC. And as we learn more information, as we figure out who spreads it, how it's spread primarily, and what's the most effective way, you can see the CDC recommendations are likely to evolve and change with time as we get more information. But for now, in Northwest, I'm Matt Gregory. Back to you.